On this episode, we're talking about toddlers who bite and hit. I cannot tell you the number of times people have come to me and they're like, my child's a biter, they are a hitter, like, what am I going to do? Like, are they a sociopath? Are they a psychopath? Like, what is going on here? And I'm like, just relax. Just because your toddler is a biter and a hitter now doesn't mean it's going to like follow them for the rest of their life. It just doesn't work that way. Because what we know from research, trajectory research that follows like aggressive behaviors from birth all the way on through adulthood, is we know that humans are the most aggressive when they're 2 years old and younger. So what that means is that humans will not be any more aggressive than when they are 2 years old or younger. Yes, of course, there's other aggressive behaviors that occur, but in regards to frequency of acting out aggressively, it's 2 years and younger. So, but why is this happening? Why are toddlers biters and hitters? There's 3 reasons. The first reason is they lack language. They haven't developed their language skills enough to let people know how they are feeling, what they want, but they can bite and they can hit people and they can kick people, and that works for them. And so it's a way to communicate because they haven't developed words yet, or they're not able to express themselves through their mouth. So they're going to bite and they're going to hit and they're going to kick. The other reason why it happens is because it's been modeled for them. If they go to a daycare facility, and again, this you will commonly hear that there's at least one biter or one hitter or someone stealing a toy from another kid. It's all because it's modeled behavior. They see someone else do it, and then they're going to do it themselves because they're like, oh, if that person's doing it, or they're getting it done to them, and then if they got bit or if they got hit or kicked, well, then they're more likely to do that as well. The third reason why is because it's an effective way to get what you want. So a lot of the times if you bite someone or hit someone and then steal their toy, you really wanted that toy and then you got it because you bit them or hit them, or people left you alone and like left your toy alone because you bit them as they were coming in for it. Well, then chances are you're more likely to do that behavior in the future, because basic behavioralism tells us that we are more likely to repeat behaviors if we've gotten what we wanted by doing that behavior in the past. Basic behavioralism. So that's the 3 reasons why toddlers are biting and hitting and kicking. They lack the language, it's been modeled for them, and it's an effective way to get what you want. All right, so what are we going to do about this? What are the strategies? How can we stop this so that it's not following our kids, so that our kids don't get labeled the biter or the hitter and we kind of just nip it in the bud? Okay, so here's the first one. Let's pretend that your kid bites you. Well, what you're going to do is you're going to grab their nose, because if you have their nose, they can't breathe out of their nose and they need their mouth to breathe. And so they're going to release the biting, and then they're not biting you anymore. This is a strategy that I was taught at my junior year of undergrad when I was doing an internship with the bad boy daycare facility. So kids 6 and under who had been kicked out of multiple daycare facilities. And I remember the teacher, Juanita, she was like, okay, one of the skills you're going to need if you're in this classroom is you're going to need to know if someone is biting you, what you do. You plug their nose, because then they have to release the bite because they can't breathe. And breathing is kind of important even for toddlers. So and it was a funny story. So I remember there was the 18-month-old boy, and we were sitting down for carpet time, and he was, in front of me, and we're doing carpet time, and then he wanted to get up, and I was like, nope, that's not the expectation. The expectation is that you're going to sit for carpet time. And he didn't like that, so he bit me, and I quickly grabbed his nose, and then he released. And Juanita was like, man, I have never seen an intern grab someone's nose as quickly as you did. And I was like, yes. So first strategy, if they're biting you or if they're biting someone else, plug their nose, and then they won't be able to do it anymore. Number 2, you're going to monitor and intervene. So when you take your kids out for a play date or something along those lines, or if they're playing with other kids, you're going to kind of sit back, you're going to interact with other moms like, hey, how you doing? Where'd you get that cute sweater? Oh, no. You're going to intervene, but you're going to kind of keep an eye out on your child. And then as soon as you see behaviors that are kind of predictive of them biting or hitting or kicking, that's when you're going to intervene very, very quickly. And you're going to remove them. You're going to interrupt the behavior. You're going to tell them what is expected of them. And then you're going to put them back in that situation. So it's a quick intervention. It's a very quick interruption. And then you let them go back and let them set them up for success. Here are ways to set them up for success. So if you see that they're going to bite, there's 2 phrases that I want you to use in a very stern voice, not a meek voice, a stern voice. Those 2 phrases are 1, that's not an option. Number 2, that's not a choice. And you tell them whenever they're biting or they're hitting, and then you give them other options. And here's another option to give them because of that lack of language. What you're going to teach them is you're going to teach them, I don't like that. And I love it when I hear little kids using their big old voices to be like, I don't like that. Because what it's telling me is that they're able to communicate that something is going on that they do not like, that they do not want. And then it brings all the adults in so that the adult can intervene, that monitor and intervene piece. And then it's going to stop those behaviors, and it's going to probably stop the biting and the hitting. And I love the phrase, I don't like that, because it empowers them. And it also is foundational for them establishing boundaries, because essentially what boundaries are is what we like and what we don't like. And if you tell someone, I don't like that, well, then guess what? They're going to realize, don't do that again. All right. So the other thing that we're going to do, other strategy we're going to use is positive phrasing. You're going to, before you go into an activity where you know your kid is going to interact with others, you're going to tell them what they should be doing with the body parts that they usually use for aggressive measures. So what that means is our mouths are for eating popcorn or something else, or kissing. Our hands are for high fives. Our arms are for hugs, and our feet are for dancing. So use that positive phrasing. We want to tell them what to do, and don't tell them like, we're not going to bite, we're not going to hit, because all they're then thinking about is bite, hit, bite, hit. But if you're like, hands are for high fives, hugs, cake, dancing and, eating, then that's awesome. Okay. So then that's what they're going to know, that's what's going to be in their minds, and that's what they're going to do. Perfect. Now, here's a question that I love asking parents because it always makes them go. So here's the question. Are you ready for it? The question is, what is an appropriate way for your child to express their anger and frustration in your household? Now, I don't anticipate you having an idea right this second, but think about it. Really think about, in your household, in your family, based off your values, what are appropriate behaviors for people in that household to know to express their anger and their frustration, because we have to be able to express our anger and frustration just in appropriate ways. And so, because we're not going to get rid of those emotions are a part of us. But we, like Layla Hormozy has recently said, all feelings are valid, but not all behaviors are welcome. I love that phrase. So we want them to know what is expected of them, what behaviors can they do when they are angry and frustrated. So for example, in our household, slamming doors when you are angry and frustrated is not an option. So sometimes when our kids stomp up the stairs because they're angry and then they slam the door, I will walk my butt up the stairs. I will open the door and be like, let's try that again. Close the door gently, please. And so then they walk over and they're huffing and the puffing and they close the door gently. And I'm like, thank you very much. Now, here's the other strategy you're going to use. Pull yourself together. So I love this strategy. When I tell my kids like, hey, go pull yourself together, they know, okay, you're experiencing some big emotions right now and you need to go figure out how to regulate yourself. I'm not one that's going to advocate for parents regulating their children's emotions, because they need to know how to do it on their own. So that's why I love this phrase that we've always used, pull yourself together. However that is, again, all feelings are valid, but not all behaviors are welcome. Let's go. All right, the last tip. Are you ready for this? And this is one of my favorite tips. If you aren't roughhousing with your toddlers, start roughhousing with them. You have no idea the power that comes along with roughhousing. I wrote a whole chapter in the No. 2 parenting book all about roughhousing and why we should do it, because of the positive developmental outcomes and how you can be doing it appropriately. And I remember when I once recorded a video on biting, hitting, and kicking for parents across, the globe. And one of the tips on there was roughhousing. And one of the reviews was, oh my God, my child was a biter. They were a hitter. They were a kicker. And then I started roughhousing with them and they haven't done any of those behaviors ever again. And I was like, winning. So that's what we want to be doing. We want to be roughhousing with our kids because then again, it gives them an outlet for that anger, not anger and frustration, but it gives them that outlet where they're less likely to be angry and frustrated in the future. And it also will start to teach them appropriate boundaries. I talk all about it. I love roughhousing. These are things. All right, so we now know why kids bite, hit, and kick because they lack language. It's been modeled. It's an effective way to get what they want. And here are the strategies. If they're biting you, you're going to hold their nose. You're going to monitor and intervene. You're going to use statements like, that's not an option. That's not a choice. You're going to use positive phrasing, hugs, high five, dancing, and eating delicious food. What's an appropriate way to express your anger and frustration? Pull yourself together, man, and roughhouse with your children. By doing these strategies, your child is much less likely to bite, hit, and kick, and it's not going to send them down a trajectory of being aggressive adults. It's normal for 2-year-olds to do this, but we want to kind of, again, stop this behavior earlier on with these strategies. And by using these strategies, you're going to set your child up for better relationships and a better life, and we're going to be throat punching this Gen Z mental health crisis. Let's go.